Now, we have our last speaker who is presenting virtually, David from Georgia, the country, not the US state, presenting on legal self-defense and access to justice for people who use drugs. Over to you, David.
Thank you, Vinny. Hello, my name is David Subeliani. I come from Georgia, and it's a pity I cannot be in Monreale right now. Like many participants, I also was not lucky to get the Canadian visa, so I'm right now presenting from Tbilisi, the capital of Georgia. I'm representing now UnMode, a relatively new network organization for people who use drugs in the EK region. The specifics of UnMode is that it is a network of human rights defenders from within the community of people who use drugs. And I'll be presenting a study that UnMode undertook in 2021. I have no conflicts of interests to disclose. Yeah, this is a study, qualitative study entirely led by the community of people who use drugs, like the members of the UnMode network, focusing on sanctity of human rights defenders, and geographically scope was like Lithuania, Estonia, Russia, Belarus, Moldova, Ukraine, Georgia, Kyrgyzstan, and Kazakhstan. Basically, these are the countries where UnMode had some people on the ground, like members who are actively engaged in human rights defense activities. The context is that in terms of HIV, we know the EK region has the fastest growing epidemic in the world. There are harm reduction programs available in most of these countries, mostly driven by the community. Some countries have a long-standing experience of using systems of paralegals also. And the Kyrgyzstan was mentioned in one of the presentations earlier. While paralegals might have a more narrow legalistic scope, there are human rights defenders working on a broader HR issues, but there are also activists, if you want, political activists, who work on a policy level around the issue of drug use. All these countries I mentioned criminalize people who use drugs, yet there are some differences. Here I'll give a very broad overview for some of them. The Russian Federation, for instance, the biggest in the region, has over 100,000 people convicted each year for drug-related offenses. It's always that preference is given to incarceration rather than to alternative punishments, and therefore the share of population of people who use drugs in the Russian prison system is growing year by year. Incarceration rates are very less and decreasing within the last decade in Ukraine. And when the study was carried out in 21, it seemed there was quite a good level of recognition within the authorities to change the threshold amounts for illicit drugs, and there have been moved towards decriminalizing people who consume illicit substances. However, it still remains highly criminalized, and on top, they have a war going on there. Moldova, too, criminalizes people who use drugs. The consumption itself is not a crime. It's punishable administratively. However, extremely high fines are applied, like many other countries also in the region. Lastly, Georgia, which is one of the strictest drug policies in the region. Very harsh sentences, sending people to prison for micro amounts, often for less than a single dose for an average user. An excellent example would be when a particular Georgian was sent to prison for 7 years for 0.00009 grams of desmorphine, the amount that can't even be seen and can be only measured in lab settings and laboratory settings. But on the brighter side, Georgia has a recent history of massive grassroots level protests by the community of people who use drugs. There was a movement called White Noise Movement. Human rights defenders and activists from the community of people being the primary focus of the study aim to identify what are the barriers these people encounter during their work, what are the threats they face, and what are the mechanisms needs for their protection. The study design was methodology was qualitative, using online survey as a tool, also in-depth interviews. It runs through typical stages of reviewing the relevant reports and literature, developing the instruments of the research, collecting data actually by running the survey and running the interviews, and analyzing collected data and writing out the report. I need to mention it again that we are very proud of it. All stages of the study and all elements of the study were carried out entirely by the members of the community. The duration was 4 months, starting from October 22 and ending in January 21. The participants, like 157 participants, the human rights defenders, basically activists, took part in this study. This slide gives us a breakdown by countries and the age group. We asked many questions to our respondents, trying to gain as much understanding as possible of what they do and how they do, what background they have, etc. Not giving here all the details, but I thought this was interesting. Just 8%, only 8% have any education training in legal issues. While their core activity is not the legal defense particularly all the time, and this chart here shows the focal areas they work on as activists and human rights defenders, they do require some expertise in legal issues to be able to more effectively help the people they want to help, and to be able to protect themselves as activists who come as a target oftentimes by the authorities and law enforcement. When asked how safe they feel when they do that kind of work, activist work, 96% say they do not feel safe, and nearly 97% have personal experience of persecution. We asked a number of questions about the organizations, groups they represent or they are associated with. Just 3% of the respondents mentioned their organizations had any policy or system in place to protect their activists and human rights defenders. What's really sad, it seems, less and less people are ready to act as human rights defenders. 40% of all the respondents we surveyed do not identify themselves as human rights defenders anymore, having stopped such activities as a result of high risks involved. Nearly 80% of them say so. Well, it's not surprising indeed. One needs to look at the left-hand side of the slide. There's a list of types of harassment encountered by the participants of the study. Well, this coupled with poor or totally absent systems of support to the activists would certainly result in losing the number of activists, wouldn't it? We try to understand how these people operate. Typically, they are members of certain CSOs, civil society organizations, which are mostly horizontal network type groups with very limited funding and technical capacity to protect their human rights defenders. Nearly 60% of the activists whom we surveyed got no training and technical support whatsoever from their organizations. And those who were lucky to get any of it were rather dissatisfied with the quality. The pay is also a significant issue. Well, over 90% of the respondents are very unhappy about the amount that they get, and most of the times they don't get at all anything. And very important, when these people get in trouble with the authorities as human rights defenders, very few of them get any assistance from these organizations. Just 26% said they got any help in such cases in the past. It is clear these people are rather vulnerable, first as a people who use drugs, but also as activists. And on top, we have a picture where all these civil society organizations, many times community-based and led groups, have no or poor systems and funding to support their own activists. All that translates into a very low capacity of human rights defenders. This is very sad. These are people ready to do the most critical work, an invaluable resource indeed, but we utilize this resource in a rather ineffective way. The study gives some recommendations, suggestions on how to overcome the situation, but it is it's a rather interesting area for the discussion, and leave it for the discussion with the attendees and of the other panelists. And I'll end my presentation with just some contact information and the link to the detailed report of the study. Thank you.
Thank you, David, for that really, really interesting presentation. And I noticed some themes, around human rights with all the various different presentations. Really interesting. Thank you to all our presenters. And yeah, we are now open for questions, for our different presenters. Hopefully we can manage this session really quickly because we don't have a lot of time. And maybe I can kick it off, in terms of the questions while we make sure that we get the other questions from the audience. I know that Maureen really was focusing on the, during the COVID pandemic. I'm wondering how the other interventions were affected by the COVID pandemic and how that was being managed. Can I go first to maybe Joseph, or is that possible?
Sure. That's a great question. We looked at that issue with a lot of the different countries in the evaluation, and it varied quite a bit. In some countries, there was a lot of disruption, and innovative approaches were used to kind of overcome the challenges of COVID. Absolutely, in many countries, key populations were, more directly affected, sometimes really targeted with an excuse of COVID to crack down on people who were living together and identifiable as a key population, sometimes because if they were persons who used drugs and they needed to get access to either methadone or to the drugs that they were seeking, they were breaking curfews, and in all of those situations, there was an increased need for legal support and paralegal actions. So there were big impacts around COVID. There was also, like I said, innovative approaches and successes in the ways in which sometimes hotlines that didn't exist before were set up so that people could access support virtually and get more information and things like that.
Thank you, Joseph. Can I go to David and find out if what Joseph has said is relevant, or any of it, is relevant to your intervention?
Yeah, absolutely. I mean, it wasn't about COVID-specific issues, but yeah, paralegals had double job when COVID broke up. Yeah, and I remember personally my own experience in Georgia, when, especially the first days when curfews started, and there was no access to methadone, and people couldn't travel from the city, from villages to city or whatever. It was a big issue, and people were sneaking out the drugs and to help each other and stuff. And there really we saw a big need for paralegals to be retrained and reused, and yeah, so some of it was done in Georgia too.
Okay. Thank you, David. Do you have anything to add with your integration intervention, Mr. Musa Manganye?
Certainly. I think we... Is it on? Okay. In our case, of course, the integration, some progress was stalled, and it became very slow, especially affecting both the HIV and TB program and also with the NCDs, because then the focus was largely on the response to COVID-19. You find the health workforce being redirected to focus their attention on the intervention. So that on its own kind of stalled and slowed down the pace in which the integration needed to be optimized in particular. And of course, the issues of mental health was less attended to, because one of the attribution within our rapid prescription and collection strategies, which is informed by our adherence labs. Wet lines tends to meet, and then there's a whole range of support in terms of education and counseling that they had stalled because of the COVID-19 regulation, because there was no social gathering. So such has really affected largely into issues of mental illness in particular. So some somehow there was a slow performance with regard to our integration. Thanks.
Thank you, Mr. Manganye. I still don't have any questions at the moment from the audience, so I'm going to proceed by asking most of the questions myself until I get questions from the audience. I would like to now go to Maureen, who presented first, and ask two questions, if I can. You quoted a certain number around men who were, I think they were the ones who were testing HIV positive, in your project. 63% were men who, were crossing from Haiti to the Dominican Republic, and they were testing HIV positive. Is that unusual, and is it possible to find out about women and or young people at all?
Okay, thank you for the question. I hope you hear me. Mostly men are the ones leaving the country, trying to find work across the border and Dominican Republic, working in sugar plantations. So that's why we find more men crossing the border. But nationally, the numbers of women coming to sites to receive services are higher. More than 60%, 70%, depending on sites, are women. But in the border sites, because mostly men are moving from one side to the other of the border to find jobs, to find work. That's why we find more men accepting services at our border sites. And as well, men are part of our priority population, so we focus on men, on reaching men in the community as well.
Thank you, Maureen. Thank you. That's really interesting. So I'm going to ask each of the presenters and I know you talked about the challenges of the different interventions, and you talked about impact and, different successes of your different interventions. But now that the COVID pandemic has subsided and we are moving forward, what is the one thing that you'd really want to see in terms of, your particular interventions and what came out of those different interventions? What is the one thing that will be positive to move us to where we need to be in terms of improving access? Can I start with you, David? Mm-hmm.
Certainly. The focus of my presentation was more kind of negative. I was more, the outcomes of the research were like more calling for more support, etc. But yeah, one thing we clearly see that if we want to move along with all that HIV response in the region, we can't do it without a community support and in order community to get more organized, more effective, etc. The community activists and human rights defenders need to be supported, and because this is a resource that's not being utilized effectively anymore.
Thank you, David. That's really quite clear. That community is really important. Thank you.